Every single morning, it's the same routine. You wake up, and before you even think about your first cup of coffee or saying good morning to your spouse, you reach for it. That little machine. You know the routine, the small sting of the lancet, the tiny drop of blood, and those long, quiet seconds of waiting for a number to flash on the screen. And if that number is higher than you expected, even though you were good yesterday and skipped the bread, your stomach just drops. I want to tell you something right now that you probably haven't heard in a doctor's office. That number is not a sign of failure. It is simply a signal. Most people believe that high blood sugar is something you only find out through a lab test, but I have been practicing medicine for over 20 years, and I see it every single week. Your body starts warning you about high blood sugar long before any lab result ever would. My name is Dr. Samuel, and today I want to show you the 5 signs your body is screaming at you that your blood sugar is too high. These aren't just medical symptoms. These are early warning distress signals hiding in your feet, your mouth, and your skin. For each one, I'll explain what most people assume it is, what is actually happening deep inside your cells, and one simple daily habit you can start tonight to protect yourself. Before we get into the first sign, I have a quick question for you. How many years have you been checking that little machine? Drop your answer in the comments below. I read every single one, and seeing your stories reminds me why we're doing this, because managing blood sugar is a journey we are walking together. Sign 21C, the asleep, foot, pins, and needless. The first sign is something almost every patient I've ever seen has experienced, and almost every single one of them has explained it away. It's that tingling numbness or pins and needles feeling in your feet. My patients usually tell me, Dr. Samuel, my foot just falls asleep sometimes because I was sitting with my legs crossed. Now, that happens to everyone occasionally, but if this is happening regularly without a clear reason, we need to talk about what is actually happening to your nerves. This is what doctors call peripheral neuropathy, and it is one of the earliest signs that sugar has been elevated in your bloodstream for quite some time. I use this analogy with my patients all the time. Think of your nerves like electrical wires. Every wire has a plastic coating around it that allows the signal to travel cleanly from your brain to your foot. When your blood sugar stays high, it acts like an acid slowly eating through that plastic coating. The wire still works for a while, but the signals start getting fuzzy, and that fuzziness is the tingling you feel. According to the American Diabetes Association, this affects nearly 50% of people with diabetes, and it almost always starts in the feet. Your daily habit, if you notice this, my recommendation for every patient over 60 is a 20 to 30 minute walk every single day. Not a jog, just a purposeful walk. Movement is the best thing you can do to keep blood flowing to those electrical wires and protect your nerve endings. And don't wait until next month. Start reducing added sugars in your diet today. Sign A2A. The fire alarm is a burning feet at night. This next sign is often the most distressing because it doesn't hit you during the busy day. It hits you at night when you're alone and trying to sleep. My patients describe it as a feeling that their feet are literally on fire. They often chalk it up to being on their feet all day or the summer heat, but when a patient tells me the soles of their feet are burning, I take it very seriously. This is a classic early sign of diabetic neuropathy. What's happening is that the nerves in your feet have been damaged by excess sugar, and now they are sending emergency signals to your brain. Your brain receives a heat message, even though nothing hot is touching you. Think of it like a fire alarm with a faulty sensor. The building isn't actually on fire, but the alarm is screaming anyway because the sensor is broken. Your nervous system is doing the same thing. The burning isn't coming from the outside, it's coming from damaged nerve tissue crying out for help. Research in diabetes care found that this burning pain is often one of the very first symptoms, appearing 1 to 3 years before a formal diagnosis. Your daily habit, I recommend 2 things for this. First, drink at least 8 glasses of water a day. Proper hydration helps your kidneys flush out that excess glucose. Second, add more fiber to every meal. vegetables, legumes, or oats. Fiber slows down the absorption of sugar into your bloodstream, which is exactly the coolant those damaged nerves need. Sign in 3, the kinked hose, wounds that won't heal. This is the sign that often sends my patients to the emergency room. They'll come in and say, "Dr. Samuel, I had a little blister from a shoe 3 weeks ago and it's still open." They assumed it would close on its own, but it didn't. When your blood sugar is consistently high, your body loses its ability to heal. The tiny blood vessels in your feet begin to narrow and stiffen, meaning oxygen and white blood cells, the repair crew for your body, simply cannot reach the wound. Imagine trying to water a garden, but your hose has a serious kink in it. The water is there at the faucet, but it isn't getting to the thirsty plants. That is exactly what high sugar does to your circulation. An open wound that won't close is an infection waiting to happen, and unfortunately, diabetic foot ulcers are a leading cause of amputations in the US. Your daily habit tonight, after your bath or shower, sit down and look at both feet carefully. Look between every toe and at your heels. If you see any cut, blister, or broken skin, clean it immediately. If it hasn't improved in 48 hours, call your doctor. Not next week, 48 hours, sign 4, the sandpaper tongue. It's a morning dry mouth. Have you ever woken up and the very first thing you feel isn't energy, but a mouth that feels like it's filled with dust? Your tongue feels like sandpaper, your lips are cracked, and you reach for water as if you haven't had a drink in days. Most people think, "I just slept with my mouth open," and they forget about it. But if you are waking up with a dry mouth regularly, your body is sending you a major signal about your sugar levels. When your blood sugar is high, your kidneys go into overdrive to try and flush out the excess glucose. And this makes you urinate more frequently, something we call polyuria. Because you are losing so much fluid, your body becomes chronically dehydrated. The dry mouth is the messenger. It's your body's way of saying something deeper is going on beneath the surface. Your daily habit, I use a method with my patients called the H3 method. The most important part is what you do the moment you wake up. Before coffee, before breakfast, drink 1 full glass of warm water. Add a tiny pinch of natural sea salt and a squeeze of fresh lemon. The minerals in the salt help your cells actually absorb the water instead of it just passing through you, and the lemon helps stabilize your blood sugar response for the rest of the day. This simple routine can also calm cortisol levels, which helps prevent that unnecessary morning blood sugar spike known as the dawn phenomenon. Sign Wi-Fi's, the crumbling mortar, a cracked heels. The final sign is one that surprises people the most because it looks so harmless. I hear it all the time. "Dr. Samuel, my heels always crack in the winter. It's just dry skin." But if your heels are cracking badly even in the summer, or if no amount of lotion seems to help, this isn't a skin problem. It's a nerve problem. Diabetes can affect the autonomic nerves, the ones that control things you never think about, like how much your skin sweats or stays moist. When these nerves are damaged, the sweat glands in your feet stop working. Your feet begin to lose their natural moisture from the inside out. Think of your skin like a brick wall. When those nerves are damaged, the mortar between the bricks starts crumbling, deep cracks appear, and those cracks are open doors for bacteria. I have had patients with cracks so deep they were bleeding, and they had been applying lotion for years with no result. Your daily habit. You must moisturize your feet every single night, but you have to do it the right way. Use a good lotion or even pure coconut oil. Apply it thoroughly to the sole and the heel, but never apply it between your toes. Trapped moisture between the toes can breed fungal infections, which is the last thing you want when your circulation is already struggling